Welcome to our frequently asked questions series. Question for today is, why do I have every menstrual flu? It's important that we understand what every menstrual flu actually means. When a woman is experiencing menstrual loss that she can reasonably manage, such is called every blood flow. When this type of flow lasts longer than 7 days, when it requires a woman to change her pad or tampon every 2 hours or less, then as such a person is experiencing every blood flow. When the person passes blood clots that are larger in size than in a quarter, and she's experiencing anemia due to the volume of the blood loss, it's heavy. And medically it is called menorrhagia, involving a loss of over 80 ml of blood in one cycle or twice the normal amount. Menorrhagia is one of the most commonly reported gynecology complaints, and it can actually be a sign of a serious problem. Now we need to go to the causes of menorrhagia. It may happen when the menstrual cycle does not produce an egg. This is called anovulation. And anovulation leads to hormone imbalance. Anovulation is common in persons who recently started menarche about 1 to 2 years, and people who are approaching menopause. An excess of the hormones estrogen or progesterone in the body, uterus, can result into heavy bleeding. PIDs, that's pelvic inflammatory disease, and other infections of the reproductive organ can also result into irregular periods. When the tissue that lines the uterus, the endometrium, when it begins to grow elsewhere inside the body, this is called endometriosis, and it's a cause of heavy bleeding. Also, we have uterine fibroids, which are non-cancerous or benign tumors. Benign means it does not pose any serious threat to the health. Can also result into heavy bleeding. Also, the use of the birth control device called IUD can lead to heavier bleeding than normal. Cancers that affect the reproductive system, like uterine, cervical, or ovarian cancers, are rarely the sole cause of heavy bleeding, but heavier periods may be a symptom of such cancers. Also, some people have inherited bleeding disorders, including the von Willebrand's disease or a platelet function disorder, which can cause heavy bleeding. We also have pregnancy-related complications, such as miscarriage or an ectopic pregnancy, where pregnancy is formed outside the uterus. This can also lead to heavy bleeding, and the use of anti-inflammatory and anticoagulant drugs, aspirin, can lead to heavy bleeding. There are some other health conditions that can trigger menorrhagia, including thyroid disorders, endometriosis, liver, or kidney diseases. Now, our next question will be, what are the symptoms of menorrhagia? We'll be looking at the things to look out for to show that someone has menorrhagia. When the menstruator bleeds for more than 7 days, when blood soaks through one or more tampons or pads every hour, when you need to change your pad or tampon during the night, when you need to double up on protection to keep from leaking, when the blood clots in your flow is larger than a quarter, when you have bleeding that is keeping you from doing normal activities, when you have constant pain in the lower part of the stomach, you lack energy, or your breath is short, can be signs of heavy bleeding. Now, what are the things we can do to stop heavy periods? Now, because we have different things that cause menorrhagia, There are also many treatment options that are available. It's possible to manage heavy periods with treatments ranging from some lifestyle changes to prescription medication. You might eat more iron-rich food like meat, seafood, nuts, seeds, leafy green vegetables that can reduce heavy bleeding and prevent anemia that comes as a result of the blood loss. Also, we need a lot of vitamin C like oranges, bell pepper, and broccoli. This will help us to absorb the extra iron in our diet. We also need to avoid some foods like processed sugar, trans fats, and starchy carbohydrates. This food makes menorrhagia actually worse. Now to the medication. Every period caused by fibroids, growths, or endometriosis might be best treated with surgery. This will be determined by doctors. It's also noticed that a number of menstruators have come to accept heavy bleeding as normal. That's why some of them don't even know that they have it or know that it is treatable. If menorrhagia is not treated, it can cause other health concerns like anemia, and makes it difficult for your organs to get oxygen. Heavy bleeding can also result into other symptoms like extreme fatigue, painful cramp, lightheadedness, anxiety, and depression. If you have a period that affects your daily life, that makes you to miss work or school, make you to plan your life around bathroom breaks, then you have menorrhagia, and you should consult a doctor for proper evaluation and treatment. Thank you so much for watching. Please subscribe to our YouTube channel for more health videos. Please comment, like, and share our videos. Thank you once again.